Welcome to Nexus 360, where we bring you the latest trending stories and insights from around the world. Today, we focus on the ongoing humanitarian crisis in Ukraine and the urgent steps being taken to protect healthcare as the conflict enters its fifth year. The World Health Organization, or WHO, has launched its 2026 humanitarian appeal for Ukraine, requesting a total of $42 million to ensure that essential health services remain available to those who need them most. This appeal aims to support access to emergency and trauma care, sustain primary health services, strengthen national and local preparedness, and coordinate the safe medical evacuation of patients requiring specialized care. Since the conflict began in early 2022, hostilities and repeated attacks on civilian infrastructure have created immense health challenges. WHO has verified at least 2,841 attacks on health facilities, and ongoing strikes on critical energy infrastructure have disrupted power generation, limiting access to essential medical services. At the same time, around 3.6 million people remain internally displaced, interrupting treatment pathways and placing enormous pressure on health services in host communities. According to Dr. Hans-Henri P. Klug, WHO Regional Director for Europe, more than two-thirds of Ukrainians report a decline in their health compared to pre-war levels, with nearly half experiencing mental health concerns. Despite these extraordinary conditions, Ukraine's health workers continue to provide care on the front lines, often at great personal risk. The 2026 appeal outlines 5 key priorities. First, WHO will sustain life-saving trauma care and emergency medical services in conflict-affected areas by strengthening emergency medical teams, expanding surge capacity, and maintaining essential medical supplies. Second, access to primary and specialized healthcare in frontline areas will be maintained, including mental health services, care for non-communicable diseases, and safe referral pathways. Modular medical units, last-mile medicine deliveries, and outreach teams will help ensure care for vulnerable groups, such as the elderly, people with disabilities, women, children, and those with chronic conditions. Third, WHO will support integrated health services for internally displaced people along transit routes and in temporary shelters, including infection prevention outbreak, preparedness, and mental health support. Fourth, the organization will facilitate safe medical evacuation for wounded and critically ill patients, working in coordination with Ukraine's Ministry of Health and international partners, including the European Union's Civil Protection Mechanism. Finally, WHO will continue to lead the health cluster, coordinating over 200 humanitarian health partners, strengthening public health intelligence, ensuring gender equity and disability inclusion, and maintaining a resilient and well-trained health workforce. In 2025, WHO reached nearly 2 million people across Ukraine, delivering 319 metric tons of medical supplies to over 950 health facilities, installing modular units to replace damaged infrastructure, providing heating and water resilience for hospitals, training thousands of health professionals in trauma care and mental health support, and coordinating over 1,200 medical evacuations. These efforts underscore the ongoing need for humanitarian support as global funding declines and millions remain at risk. As the conflict continues, the 2026 appeal represents a critical effort to prevent further deterioration of health outcomes and ensure that people in Ukraine can continue to access the care they need by supporting frontline health services, enabling safe evacuation, and reaching displaced populations. WHO is working to protect lives and maintain the resilience of Ukraine's health system. Stay tuned to Nexus 360 for more updates on this and other important global stories.